Good evening. I'm Maria Muro, publisher of New Orleans Living Magazine and your host for New Orleans Living Show. We have a lot to cover, so sit back, relax, get inspired, and enjoy the show. Tonight, we'll be talking about breast cancer awareness. I have Dr. Gardner in the studio who will discuss a local hospital's wonderful 31 Days of Pink program. Then, we will meet a three-time cancer survivor who shares her story with us. So now let's get started. All right, on October 1st, Touro Infirmary launched its fourth annual 31 Days of Pink campaign. It's a local movement to raise breast health awareness and build a community focused on beating breast cancer every day of the year. And so I'd like everybody to welcome Dr. Gardner. Thank you so much for being here.
Thank you.
I love the pink tie. Love the pink tie. You're definitely doing, you know, the 30. Are you going to wear a pink tie for 31 days?
I have been so far.
Oh,
yes.
That's a lot of ties, but okay. All right, so let's get started. I know that, you know, we're here to talk about 31 Days of Pink. First of all, tell me what exactly is this 31 Days?
Well, 31 Days of Pink is a campaign that started, as you mentioned, four years ago, and it's really to increase awareness about breast cancer, give people a forum to really express ideas and talk through 31daysofpink.com, which is a website, and really, and it's up and running throughout October.
Okay.
So people can visit that, and really it gives people a way to share information, to access information. We really want them to be able to go online and blog about breast cancer and their experiences with breast cancer.
I think it's a wonderful idea.
Yeah, and then there's other aspects to it as well, such as they can go shopping online, and some of the proceeds are brought back to Touro through our Supportive Cancer Care Center to fund some of our programs in that department. Well,
look, I think when it comes to you know, pink, shopping, and a really wonderful cause, it goes very well together. But before I go through all of the other fantastic details that we'll get to about, you know, how you can support the 31 Days of Pink, let's talk about you, Dr. Gardner. I know you're a psychologist, and, you know, again, I think that what Touro is doing is fabulous, that, you know, you deal with women as a whole person who are dealing with cancer. Let's talk about your experience as a psychologist and how you work with these patients.
Yeah, I think one of the things that Touro did 5 years ago when I came on board is made the commitment to treat the whole person and not just the disease. So whether it's breast cancer or any form of cancer, we know through studies that have been conducted that people are affected in many different ways. It's not just a medical condition, but it's certainly they're affected psychologically and emotionally. Depression and anxiety tend to be very common experiences that people have. There are also resource needs that come up because they're not able to work, so financial challenges that surface. Nutritionally, when they're going through treatment, they have their needs there. So there's just a whole host of what we call supportive care needs or non-medical needs that surface for people. And so if you're not treating the whole person, you're missing a big part of what people go through, and they struggle.
They struggle because they need to go home. So, for example, if you're doing chemotherapy and then you go home, but you're sitting there, and some people don't have a spouse, or, you know, people have different types of, you know, circumstances. How does someone, you know, keep their hopes and morale really high to beat the breast cancer? Let's talk about the importance of having a positive attitude and how your team works with patients to ensure that, you know, they're getting the best of everything at this very, very difficult time in their life.
Yeah, I think one of the things, a positive attitude, and as you say, hope is absolutely key. And so what we try to do is help people identify where maybe that hope is beginning to diminish through supportive counseling, which I conduct regularly with patients, and also through support groups that we have available, and you see at a lot of different cancer centers. Certainly getting that support from other women who've gone through breast cancer is hugely helpful. I've seen people in support groups really struggle when they come into a support group and not really knowing what to expect, and then within that hour and a half of leaving the group and having that support from other women, they recognize that, like, I can get through this, and that
I'm
hope
not alone.
Yeah, I'm not alone. Exactly.
Absolutely. And Dr. Gardner, so when a woman is diagnosed with breast cancer, does she immediately get referred to your cancer support care center? Tell me about that.
Yeah, that's what we'd like to see happen.
Okay.
I mean, Touro is kind of an open system, whereas we receive referrals for other treatment modalities like radiation oncology. So they may have already been through some of the stages of their treatment at that point. But even then, we like to meet with them. I like to meet with them, and what I try to do is proactively help them address their supportive care needs through what's called a new patient orientation.
Okay.
So I'll meet with them for about 30, 45 minutes. We'll talk about what their needs are, and they may be able to identify those needs, or then again, they may not. But either way, they've made that contact with me, and so they know who to kind of call or come back to should something arise. We also have a patient navigation program, and that navigator is really there to help our patients.
So your patient doesn't feel like they're getting moved from from radiation, oncology, and because the cancer care team is a big team, right?
Right. There's a lot of moving parts.
Right. A lot of moving parts. Exactly. So that's where your patient navigator comes into play, is to keep that person, I guess, the system flowing properly. And tell me a little bit more about that.
Yeah, one of the things that happened, and it was because of breast cancer. Early, I think it was in the late 80s, early 90s, Dr. Friedman, Harold Friedman, who's past president of the American Cancer Society, he recognized through his hospital in Harlem that women with breast cancer would oftentimes be diagnosed early stage, yet by the time they actually got into treatment, they would be in advanced stage, and they'd sort of fallen through the system or fallen through the cracks, and so that's where navigation first came about. Now you see it, thankfully so, throughout the country, and it's really a pretty much a standard part of cancer care now. At Touro, our navigator really is there to help people from falling through the cracks. So if something comes up where they have an issue with insurance, or they can't get an appointment scheduled, or they have an issue with their family or transportation or something along those lines, she's there to really support them and help them through those difficult times, but then also just to be there to hold their hand, as they go through treatment.
Absolutely. And Dr. Gardner, as somebody who meets with obviously breast cancer patients on a daily basis, and you guide them through this journey, what would you say is something that all of these patients have in common? Is it fear? Is it like what do they experience? Thank God I've never had cancer, but it must be such a traumatic experience. Right. So tell me how you deal with the trauma, because I've heard they go through denial. There's different stages, I guess. So talk to me a little bit about that.
I think the common thing that anyone who's had cancer recognizes is that initial shock. I wasn't prepared for this, and how could you really be prepared for it? My mother had breast cancer. My wife has had cervical cancer. So it's something that I think we've all know someone who's been affected by this disease, and so consequently, that initial shock, it's once that's worn off, then for many people it's okay. The fight comes in. Let's get to it. For others, it's not that easy, and that's where I think I come in, and others really come in.
That's where you come in, and I think that's where the 31 Days of Pink come in, because there's women out there who've survived, like our next guest, 3-time survivor, and I think that by sharing their stories, they're able to help other women who are going through breast cancer. And so I want everybody to check out the 31daysofpink.com. And so some final words, Dr. Gardner, how can people get involved?
Well, I think one of the things they can do, certainly go to our 31daysofpink.com. You can actually register for the Komen Race for the Cure.
Okay.
And that's held on October the 26th
All
this
right,
year.
we have some time, everybody.
Yes. So you can go online and walk with us. We would love to have you as a part of the Touro group, or
Where's the walk being held?
It's at City Park.
City Park.
Yes.
Perfect. And I'm sure the weather's going to be amazing.
Let's hope so.
All right. So everybody, I want us to put our running shoes on, and please go and register at 31daysofpink.com. And Dr. Gardner, thank you for the work you're doing at Touro. And again, I love that, we have a psychologist here today to truly talk about, how to help women go through a very emotional and scary time in their life. And again, thanks to Touro for doing that.
Thank
you so much. And you need to fix that little thing on your nose. I just had to say that. He kind of bumped into something. All right, we're going to take a break, and we'll be right back.